I'm going to give a rundown of vaccine allocation by channel and give details of new funding that has been made available from the CDC, federal dollars. As the governor indicated, we are receiving 316,000 first and second doses this week for next week. In terms of allocations to specific providers, the mass vaccination sites receive 101,890 doses. Health systems and healthcare providers will receive 99,230 doses. Community health centers, this is outside of the federal allocation, will receive 27,450 doses. Regional collaboratives will receive 40,370 doses, and local boards of health for particular projects will receive 19,210 doses, and those are particularly for equity communities as well as engaged in doing low-income and senior housing and ensuring that we have second doses. We are also providing 19,180 doses to mobile clinics that support long-term care facilities, congregate care. We have more than 2,400 group homes in the Commonwealth of Massachusetts, and affordable and low-income senior housing and homebound individuals that are not done by the local boards of health. Retail pharmacies will receive 8,490 doses from the state allocation. This is outside of the federal retail pharmacy program. And the retail pharmacy program provides 106,440 doses to CVS in Massachusetts. It's worth mentioning that while these distribution numbers are helpful, they do not necessarily indicate how much vaccine each provider has. Providers must use the allocations they're provided before receiving more. That way, as the governor said, we can provide more sites with vaccine that can administer to people faster. Today, we are really pleased to announce $27.4 million grant from the Center for Disease Control and Prevention. The funding will be used to increase trust, vaccine acceptance, and administration rates as part of the administration's Vaccine Equity Initiative and to meet the needs of high-risk populations. As we have underscored repeatedly in the last several months, with the vaccine rollout, a core commitment has been to the principles of preserving life and addressing equity. We must be intentional and public about steps in order to be equitable. And with the allocation of this new funding from the federal government, we are being intentional with where the money will be spent to ensure equity. The funding is split into 5 core components. Mr. Mayor, $4.7 million will go directly to municipalities and their local boards of health in the 20 communities for vaccine clinics and vaccine acceptance, and it's not a procurement, so it is a best-in-class offer. So it's like it is a ML Sudders short form. Just a couple of examples of this support: collaborate with key stakeholders, including local community and faith-based organizations, community health centers, and community health workers who can support grassroots outreach. Support additional staffing, public health nursing, epidemiologists, and resource needs. Identify gaps in acceptance and address hesitancy with trusted community voices in partnership with Archipelago Strategies Group and Healthcare for All. But we've listened to the municipalities to get the funds out as quickly as possible. $4 million will be dedicated to tailoring outreach and education on COVID-19 vaccine via direct grant funding for community-based and faith-based organizations in the 20 equity communities. And again, some of these already have grants, so we'll be extending the grants, and then there will be a very quick procurement for new ones, working with the municipalities. $10.6 million will provide direct assistance with vaccine access by funding direct services such as appointment registration assistance, transportation to vaccine clinics, mobility assistance, medical interpretation, and whatever other supports that to be delivered through these contracted community-based organizations. Again, we're trying to eliminate any barriers that may exist. And $3 million will be for direct vaccine administration in community settings. The funding will go to qualified organizations to directly administer vaccination to groups not effectively reached by other outreach efforts. Some examples: those residing in homeless encampments, people who are on the streets who are homeless, individuals with serious mental illnesses, and those who are resistant or afraid to access vaccine through conventional settings, including migrant farm workers, people who are undocumented, individuals who identify as LGBTQ questioning, and others who face barriers to access vaccination through existing access points. And finally, I am pleased to announce an additional $5.1 million for community health centers. The Massachusetts League of Community Health Centers is the recipient to support COVID-19 vaccine distribution in community health centers. And again, trying to make it as easy and fast as possible for community health centers to get the resources you need in order to ensure vaccination across your entities. The funding, as I said, may be used by community health centers to support critical workforce equipment needs, outreach, education, community health worker ambassadors. Again, trying for us not to tell you what your needs are, but for you to tell us what your needs are and for us to provide the funding. I want to close by underscoring once again our commitment to the 3 pillars of our vaccination effort in Massachusetts: to preserve life, protect our healthcare system, and to achieve equity. Equity will continue to be at the forefront of our efforts as we receive more vaccine from the federal government.